Good morning, everybody, and welcome back to your Lunch Break Live. My name is Ivana if you're new here, and if you're not, thank you so much for coming back. Today, we are going to take a little bit of break from weather. I know we've been really focused on that this week, and we're going to talk a little bit more about coronavirus vaccines. I know that's something that is very fresh in most people's minds, and even with the weather, it doesn't get very far, I think, from a lot of our thoughts. So I've got our own Leada Gore here today. We're going to talk about the vaccination numbers, how we're doing as a state, and what's going right, what's going wrong. So we're going to take a look at that. And Leada, I've got the dashboard here from the ADPH that I will pull up in just a minute. But I think that kind of the headline here is that we did really well last week considering where we had been on this vaccine rollout.
Yeah, we did. We saw a huge increase in the number because we had these 8 mega sites that were just pumping out vaccines. That enabled us to see this really big jump. But you can, what the state made clear is you can only do that if you have the supply to do it. And so they had rotated around some supply, moved some stuff around so that they could really focus on quick vaccines, which is what we needed. And then we had the weather this week, which we'll talk about, really has, you can see on the dashboard, just pummeled us as far as our numbers, but there's an upside to that too, which we'll talk about.
So I've got this dashboard pulled up here, and I think this is just kind of a good overview. And this really shows you that last week, which is if you're looking at that graph, it is the second to last bar on the graph, the highest bar. That shows you the last week, the week of the 13th, and it shows you the amount of vaccine doses that were administered that week. Now, as you can see, that was our highest week. We really did a lot better. I know a lot of people were really down on Alabama for being the lowest actually in the nation for vaccine rollout. But last week, according to some reporting we have this morning, Alabama had a 31% jump in administering those COVID shots. So as you can see here, there were over 83,000 doses of Pfizer that given out and over 65,000, almost 66,000 of those Moderna shots out last week. Now that is a huge drop to this week where we have just 12,000 Pfizer and about 20,000 Moderna. So granted, there are still a few days left in the week. That's a huge drop off right there.
It was a huge drop off. I know that, was it Tuesday? My days are running together, y'all. I apologize because we've had such crazy weather up here. I think it was, okay, so Monday you had a federal holiday. Now they were still working on a lot of those, but there was a slowdown. Then on Tuesday you had weather. Wednesday we had threats of weather. Thursday up in North Alabama we've had bad weather. So we saw a lot of clinics because a lot of these are held in outdoor locations. Roads were closed. People are not getting out and traveling. That we saw those clinics get shut down. And this slowdown is probably going to stick for a while because the federal government has also said the weather in different parts of the country is impacting shipping of vaccines in general. So we're probably going to see a slowdown. Now, the plus side of that is people are inside. They're in their houses. They're not out shopping. So it's almost like we have a COVID lockdown just because of the weather. Mm-hmm. So that will help. We have seen our COVID numbers fall dramatically over the last week, or over the last, I would say 3 weeks. I saw one day this week we added 455 cases. Now back in June, that would have been record breaking. It would have, I remember the first time we added 600 cases, they sent out a press release because it was that big of a deal. Now, we were up close to 2,000, and we're really seeing those numbers decline. They're contributing that to several things. One is partially a vaccine. And then also like viruses in general, we see an ebb and a flow on how they're going. Mm-hmm. So Alabama's numbers, if we can keep those case numbers low and get over this hump of bad weather to get the vaccine out there, we could really get ahead of this. What we keep running into is what everybody's running into is getting enough vaccine to get it out to people.
Now, I know again, I mentioned it before, but I'll say Alabama had a 31% jump in those COVID shots last week. I'm looking at some numbers here so I get them
Yeah.
right. And that means that we had 149,201 doses given last week. That's a combination of those two bar graphs I just showed you, those two colors of the bar, the Pfizer and the Moderna shots, right? So 149,201. Now, that's the increase of 31% from the week prior. The problem is, even before this weather hit, we know last week, Dr. Scott Harris, state health officer, said the state was not getting enough vaccine doses to keep up with that pace. So that is a problem that we are facing here. And I know that's a problem that a lot of people are asking and talking about, Leada, is what can we do to keep up with that pace if we're not getting the shots to Alabama? We know that the Montgomery and Selma clinics, those are just two to name, didn't even reopen this week, and they weren't even set to reopen. It wasn't weather related. They just didn't have enough vials of that medicine to reopen.
Yeah, and that's something that the governors are really pressing the feds on. Just this week, Alabama Governor Kay Ivey joined in with a bipartisan group of governors who sent a letter to the Biden administration saying not only do we need more vaccine, but we've got to know, for example, there's like allotments of vaccine. So the state has an allotment and the federal government has an allotment. And if you hear, okay, the state's running health department vaccinations, that's from the state allotment. But if you hear Walmart's giving vaccines, that's from a whole separate federal program. Now, they're included on this dashboard, but you can see where someone trying to plan vaccine distribution, that makes it very difficult because there's not like a central source of here is a vaccine, this is how much you will receive. The other issue that they have had is, so we saw where the state announced or the federal government announced that Walmart was going to be a partner in Alabama. So Walmart says, here are our locations. Well, people immediately noticed there are none in Jefferson County. There were none in Birmingham. And it took some work from some Birmingham City Council people to get those locations added. So not only do you have a slowdown in vaccine, you really have a breakdown in sort of this communication of who gets what, when they get it. Now, granted, this is new. You know, we've not done something like this in a really long time, if ever. So there are some hiccups, but it's going to take a massive amount of vaccine, and that takes time to produce for lots of reasons. We didn't have that ready to go. Now, when Johnson & Johnson's vaccine comes on board, that will speed things up again, and it's a one-dose vaccine. So the good thing about this slowdown is that while we are locked down, we're not going to see the rate of transmission, but also we're learning, you know, the government says you need your second dose 21 to 28 days, depending on which one you take, but you actually have up to 6 weeks. So we're seeing, you know, people are not panicking and rushing, and there seems to be no issue. I've not heard anybody that needed a second dose that could not get it. So those are positive things. It's just going to take a while. You know, we saw this massive push. I think we will see another one in the next 2 to 3 weeks, and it's just going to be like this till probably June or July.
Now we've got a couple. You talk about that second shot. I've got two people. I've got Susie and I've just got one. I got Susie saying, "Look, I got to get my second shot at EAMD, that's East Alabama Medical Center, in the Opelika region next Tuesday." Is that going to happen? Not regarding weather, but are there enough to give those people a second shot?
Yes. The second shot. This is, you know, what we have been told is that when you get that first shot, that second dose is allocated to you. They're not just using them all up and hoping they get more. So your second shot should not be an issue. And hopefully we won't have snow, so it won't be an issue there either.
Right, I'm ready for that spring weather.
Me too.
I think we all are. Now, I love the snow, but I'm ready. You know, I don't like the in between. I got Donna saying she got her second shot yesterday. Donna, I'd love to know if you had a problem getting it, but she said she's very glad. And I've got Jay said he's getting his in an hour. So good. I'm glad to hear it for y'all. Now, quick question I will answer is Adam asked about the state and the federal numbers. So this number right here, the 663,056 doses administered. That is just state, correct?
No, that's actually both. That is both. My eyes, y'all, it's old age. I have to blow this up. If you see the doses administered by the federal, hold on, let me scroll down here. Well, hold on, because we may have, sorry, just a second. I'm reading live here.
You're good. While
yeah,
you look at that.
Yeah, you're fine. What the ADPH said is basically, they were sort of separating out the doses delivered to Alabama, like here are the state doses, here are the federal. And this just sort of reiterates what we've said before, is that they're no longer going to break those out. They're just saying this is how many doses we've got, because it simply gets more confusing when you're trying to break it all out of this is federal. They're just looking at a total number. But it is, let's see. Yeah, it's just very, I'm not saying it's not accurate information, but it is hard to decipher information. Let's just put it that way. And I will look back through this, because this note is brand new. I will look back through this and put some notes in our comments if we need to elaborate on that a little more.
Now, in this dashboard, we see that over 1 million doses, though, have been delivered to Alabama. Yet that doses administered is hovering around that 663,000 number. Where are the other 400,000 or minus a few?
Well, those could be follow-up shots. Those could be ones that, they have to be used during a certain period of time. My guess is most of those are your second doses. What's interesting about that is, rough math, 60%. Of our doses have been given out. We were hovering around 30% for a long time, that we were just not getting out that vaccine. So I think what part of it is, they have a better estimate. I think it's 65,000 doses a week they're getting in. So they're getting a better estimate of the supply chain and the flow that's coming in. So we are probably less hesitant to give out. We're not holding back as much for those second doses. Not that we're not holding back what we need to give, but it's just the fact that we're a little bit more confident, and we're seeing what we're going to get. And that's going to change. I mean, there will, if we're going to vaccinate 4 million people in Alabama, take out your kids for right now, it's going to require weeks of 100,000 doses or more. And that's, shipments of 100,000 doses, where we're vaccinating just massive numbers of people.
I've got a question here from Sandra asking about, when can a 60-year-old get vaccinated? So Sandra, that is not 60. So that is
not right now.
Exactly. So somebody had said now, but no, Sandra, that is not correct. You cannot now. That is what is open now is, I guess it depends on your profession. If you are a teacher, if you are a healthcare worker, if you are a grocery store worker, and some of in some of those categories, then you can. But if you are not in any of those other categories, and you are a 6-year-old that is in another category, or if you are not in the workforce, then that is not the case for you. You are not eligible yet. Leada, we got a lot of people wondering when these people under 65, either those with health conditions or just the next group of under 65, when is that going to be open?
We don't know. And the health department has been very open in the fact that they do not put time limits, or it's not like we do this for 2 weeks, then we do this for 2 weeks, because they just don't know. For example, if you had put a 2-week notion on the age 65 to 75, and then we had a snowstorm, what do you do? The issue that you run into also is when you say, okay, we're going to vaccinate people with comorbidities. In some states, and if you look at Alabama's details, I believe it's Alabama also, contributing factors include smoking and obesity. It is very difficult. It is very difficult if someone has diabetes, or they have cystic fibrosis, or some of these illnesses. It is very, I'm not going to say easy to identify, but you can tell who those people are. If you're a smoker, and is there going to be this big uproar that you get to jump a line and you may be ahead of somebody else? I would hate to be the one making those sort of decisions, but according to Alabama's plan, comorbidities cover, I don't know the obesity rate in our state, but I know it is extremely high, and obesity is a comorbidity. So we could see where we saw 1.5 million, I think, eligible for vaccines in this last couple of rounds total. You're talking, 2 million or more. A lot of people that are going to be waiting to get a vaccine. So I would not be shocked if we don't see the next phase, you know, in the past, Alabama's kind of broken down some of those phases. They didn't just say everybody in 1A come on. I think you will see that divided up in a way where we may do, let's say 65 to, well, let's say 60 to 65. Or, you know, I just don't see them opening the door right now because I think it would create such a logistics nightmare if you say everyone with a comorbidity.
Mm-hmm.
You know.
And Julie, I hope that answers your question. That basically the answer there is we don't know. We don't know when that date is going to happen.
In the health department, I don't think they know. I mean, I think they probably have some projections, but it is certainly not public record.
Right. Now, a couple questions here for you, Leada. I've got one from Darlene. She said, look, I'm waiting on my second shot in Fort Payne, and it's supposed to be coming up here, but the company says they don't have any on hand. They're waiting on a shipment, and they'll call when they receive it. Have you heard of people saying, look, I'm due, but my doctor told me not to come?
I have not heard of that, but don't stress too much because, like I said, the CDC has said from the very beginning, you've got 6 weeks. Now, granted, I would want my second vaccine, you know, right on the day that I could get it. But I have not heard of issues getting the vaccine for the second dose. I have heard that people would have to wait a few days, and usually it was logistics to get in, not that there wasn't vaccine available. I would. That's an interesting one.
And then I've also got Sherry here saying Montgomery County Health Department has been sending out notices to some registered people that their appointments are being postponed. My sister was scheduled for March 24 and they rescheduled her for May. Why is that?
Like an initial dose? Does she say if it's an initial?
No,
dose?
Sherry, jump back on here and tell us that this is her second or initial, but that's a pretty hefty delay. We know that some places were postponing appointments because of weather this week.
Yeah.
I know some of those larger UAB run drive-through clinics or outdoor clinics had closed, I believe, Monday and Tuesday. We're going to reopen for Thursday and Friday. So a couple of days we've seen that this week because of weather, but that's quite a bit. So I would love to
encourage anybody who runs into that to explore all your alternatives, explore surrounding counties, explore local pharmacies. The way we rolled out who's giving this vaccine was very confusing because you have health departments and they would say, well, our schedule's full, but there are pharmacies who are offering it and their schedules aren't full. And then there's, you know, private, I mean, you have Walmart that's offering these, not everywhere. You just have to be very persistent. And the thing that worries me about this vaccine rollout is we made it very difficult for members of our society that, you know, now not to diss your 94-year-olds because my 94-year-old grandmother's on Twitter, but you know, she's not as comfortable going to online to schedule an appointment and she couldn't get through on the phone. So it really took some family members to get involved to kind of, I mean, it took a bunch of us to get that appointment. I think we made that very difficult. I'm hoping as supply picks up, that becomes where, you know, my local CVS gives out flu vaccines. Publix, I got a $10 gift card for getting my, you know, flu vaccine at Publix. That eventually we'll see it just like that. We're like, oh, let me get some milk, and by the way, let me get my COVID vaccine. I hope that's the case by June.
Right. Well, and I don't even want to know the money that I spend at Walgreens every year. So, you know, if that's the case, it's like you said, while I'm there getting all my essentials, you know, I'm here, let's do it. I've got Sherry saying that that was from the Montgomery question. And she said that was her initial vaccine. So Sherry, I think our advice to you would be, look, you unfortunately, as Leada said, you've got to work to get this. And that is maybe not how it should be, but that's unfortunately the reality of what we're dealing with, is that you go more than one avenue. So I understand that your sister, you said, was trying to get it at the health department there in Montgomery County, but I think we would tell you to explore that. I've got a couple of people asking, how do they do that? How do they explore that? How do they know where to go? I'm going to get all those links. I'm going to put here in the comments so you can read what we do have. But Leada, in a nutshell, what's the best way to go about finding your vaccines? Again, I'll leave all these links here. But.
Yeah, there's a great source on AL.com on how and where to get your vaccine, which Ivana will link up there. But if you go to the Alabama Department of Public Health website, and you look under the COVID tab, you have to kind of click through at the top. I'm telling y'all, I know it's not easy. There's a COVID tab at the top, and it'll say COVID dashboard. Click on that, and then you can go to vaccine providers. And you can really start to see up there, you'll see vaccine clinics, vaccine distribution. And I'm not just pitching this because it's us, but the best source to find just one spot is AL.com, because there is how and where to get a vaccine that really list out these locations. And I know this week when they added the Birmingham locations of Walmart, we had it. So, you know, Google is your friend, AL.com is your friend. But, you know, if you don't want to navigate the health department site, how and where to get a Google vaccine, I mean, a Google vaccine, dear Lord, a COVID vaccine. And I would start there, you know, I would start on that how and where to get a COVID vaccine that was on AL.com. I found it extremely helpful.
I did as well. I am going to quickly see if this helps anybody. And this is what Leada was talking about. This is the State Department of Health's website. This is where it takes you when you go to alcovidvaccine.gov. And this is what she was talking about, those tabs. You can say schedule vaccine, get notified. Now, keep in mind, I had to explain this to several people, as Leada said, kind of family members that were maybe not as like tech savvy. Schedule a vaccine and get notified are not the same thing. Right. Getting notified somewhere tells you when you are eligible. Scheduling the vaccine is a totally different ballgame. But keep in mind, again, as Leada said, scheduling this doesn't give you every single location that's giving out a shot. And that is a problem. That is something that a lot of people have been upset about. But that is the reality here. So I'm going to I have not done this before. I'm going to walk through this and see if this works. You click schedule vaccine, and this is what it does. It pulls up a questionnaire. It's asking if you're getting your first or second. You go ahead, Leada.
Oh, no, I was just going to say, I did walk through this because I was curious. And, you know, it is not hard. It is not as simple as here's your appointment, go ahead, because there are some questions you have to answer. What I wish there was, and maybe smarter minds than me can come up with this. I wish you could click on a map that had a counties and it would show you every location in one place. Like, here's the Walmarts, here's the health departments, and here are the private pharmacies, like all in one place. And I've not found one that just shows everything, but you know, maybe we can get that, or maybe smarter minds can develop that.
Well, and this is sometimes what you get. So I clicked Jefferson. I said first dose and then Jefferson on this ADPH website. And then it gives me a notice that says the county you've selected is not taking online appointments. So that's frustrating. I understand that. But there are other places you can go and you can try to get that shot. So we'll leave all that information here. I have one quick question, though, for you, Leada, before I let you go. And that is from Kelly. Kelly, I think this is a great question. She said, if somebody goes to a different location for their second shot, is there somebody keeping track of these records?
There's supposed to be, yes, because that's going to happen. Yes, that it's just like, you know, everything else. I can't tell you that it's a perfect system because things will probably happen. But yes, that is supposed to be tracked, just like you would track any other patient record.
Got it. Well, Leada, thank you so much for trying to break all this down for us, giving us the kind of good news that we were doing better in our vaccine rollout, but maybe the not as good news saying that this week is not going to be as good. But again, we're going to put all of those, how you can get your COVID vaccine, where to get one. We're going to put it all in the links here so you have all that information. And Leada and I will be jumping in on those comments too if you have any specific questions that we didn't get to. So thanks again, everybody.
No problem.
Thank you so much for watching. We'll see you tomorrow.